If you've never been to physical therapy before, you might be wondering what actually happens on day one. Even if you have had PT, every place is a little bit different. So let me walk you through what a first visit with me looks like so you know exactly what to expect and why that first visit is one of the most important. Hey everybody, I'm Dr. Dominic Rangel. I'm a physical therapist here in San Antonio. Whether you're coming in for general pain, post-surgery recovery, or traumatic injury, your first visit sets the tone for your entire plan. It all starts with just a conversation. We'll talk about things like what's bothering you, how long has it been going on, what makes it better or worse, how it's affecting your daily life. I'm listening for patterns and asking questions to get to the root cause of the issue, not just the surface symptoms. The surface symptoms are only what we start to address to get you out of pain. But going after the root cause is what allows us to make sure it doesn't come back once the pain is gone. I'll watch how you move. This is what gives me the bulk of my information. I need to know what movements you can tolerate and which ones you can't. That's where I start to think about which exercises I'm going to give you and what level I think you need to start at as far as difficulty is concerned. We'll look at joint mobility, strength, posture, balance, and maybe some sport specific or work related motions, depending on what your goals are. This tells me what's moving well and what's not. So depending on what we find, we'll usually do some hands-on treatment right away. That could be things like soft tissue work, also known as like massage, joint mobilizations, cupping, dry needling, or guided stretching to help calm things down and improve movement. We want to start addressing the pain visit one. Before you leave, we'll map out your game plan. How often do we need to meet? What exercises to start with at home? And what we'll focus on in future sessions. The goal is to build momentum and keep you progressing, not just treat the symptoms. This isn't cookie cutter therapy. You're getting a customized plan focused on the root cause of the issue with one-on-one attention the whole way through. I want to ensure you're progressing and completing all movements correctly because this is what makes the difference between average improvement and great improvement. If you're on the fence or nervous about starting PT, that's very normal. But taking that first step can change everything. I'm here to help you move better, feel better, and get back to doing what you love. Let's talk. It's the only way I know how to point you in the right direction. The info on how to get in contact with me is in the description, but you can also call or text me at 210-390-6577. Make sure you hit the subscribe button if you want straight answers to real PT questions.